Welcome to Collidescope, our collision series. My name is Rachelle Gietzen.
And hi, my name is River Charles. We are excited to share a series of collision cases with you.
And by that, we mean that there will be one case with 2 or more diagnoses in the same patient.
So today we have another collision case. Rachel, how are you doing?
Good, how are you?
So I'd like to tell you more about this case I have today.
Oh, cool. Tell me more.
So the patient's a 50-year-old man with a history of hypertension, obesity, prediabetes, and chronic kidney disease. Serum creatinine was 1.2. There is 1.3 grams of proteinuria per day, and then CT imaging showed normal kidneys.
Okay, so what did the biopsy show?
So by light microscopy, here you could see the overview of the kidney biopsy, and here up top we could see the cortex, and here in the middle we see a fragment of medulla. So in the cortical sample there's a little bit of fibrosis, probably moderate. So here, if we zoom in on the glomerulus with the PAS stain, we could see there's mild mesangial expansion here. Here, we could see another glomerulus with the PAS stain that shows an area of segmental sclerosis. Again, there's minimal to mild mesangial expansion. This is with the silver stain. This is a glomerulus, zoomed in view of the glomerulus, some mild, kind of weakly argillophilic mesangium we could see here. And so that's all the findings by light microscopy.
Oh, wow, interesting. And do you have immunofluorescent findings?
Yes. So here's an image, a high power image of a glomerulus with the IgA stain.
Looks granular. Or what did you think?
Yeah, exactly. So we could see some granular staining within the mesangium here. What do you think about the capillary loops?
Yeah, it's more in the mesangium, I would say.
Yeah, so it's a kind of granular mesangial dominant staining with IgA. So here now we have the IgG.
Oh, wow, this looks totally different than the A.
Yeah, so how do you think this is different from the IgA?
It doesn't look granular anymore. How would you describe this pattern?
So I'd say this is kind of mesangial dominant staining, and as opposed to granular with the IgA, this appears more smudgy.
Huh. That's interesting.
So here's the kappa staining. And so we could see here there's a combination of both the mesangial there's mesangial staining here, but there's a combination of the granular staining we talked about. But there's other areas that are more smudgy within the mesangium, so there's a combination.
Wow, so there's 2 patterns in this field?
Exactly.
So what about the lambda?
So here we have the lambda, and again, we see a combination of the mesangial granular staining and then other areas that are more smudgy.
Yeah, it does look smudgy in these areas. So what did the electron microscopy show then?
So here we could see the mesangium on low power, and we could see kind of scattered electron-dense deposits within the mesangium.
Wow, what are these structures?
So here we could see another area of the mesangium with fibrils that are kind of randomly arranged and measure about 15 nanometers in diameter.
So did you order any additional stains for this case?
Yes. So here we could see a DNA JB9, which highlights mesangial staining within a glomerulus. And
wow, so it's in the capillary loops and in the mesangium.
Yes. So here with the granular mesangial staining with IgA, that makes you favor like an IgA nephropathy.
Okay.
But there is concurrent positive staining with DNA JB9. So this is a rare collision case between IgA nephropathy and fibrillary glomerulopathy.
Okay, so that was a very interesting case. Thanks for sharing. And I wonder if our listeners have come across these 2 diseases colliding and if they think they're separate entities or if they could be related in any way.
Yeah, so thanks for joining us for this collision case, and we look forward to seeing you next time.